Hi everyone, today I am going to demonstrate on how to administer oxygen by nasal cannula. So the first step is to check the doctor's order. Next is bring all necessary materials needed on the bedside stand or overhead table. Bringing all the materials needed will help us to perform our task efficiently and effectively because we don't have to go back and forth when we need something which is time consuming. Next step is to perform hand washing and put on PPE if indicated. Hand washing deters transmission of microorganisms and bacteria. Next is identify the patient. In identifying the patient, we have to use at least two identifiers, ask the patient's name and check the patient's name tag, and then compare these identifiers from the medication administration record to ensure that we are giving the medication to the right patient. Hi, good morning. May I know your name, please? Thank you so much, Mrs. Santos. After identifying the patient, you can now close the curtain around the bed and close the door to the room to ensure patient's privacy. Next step is to explain the procedure and the reason for doing it to the patient and review safety precautionary measures when the oxygen is in use. Don't forget to place a non-smoking sign in the area as needed. Explanation will lessen the anxiety or discomfort of the patient towards the procedure, and placing a non-smoking sign will prevent any kind or possible accident. Mrs. Santos, I will be administering oxygen by nasal cannula, so this will help you breathe normally, okay? Thank you so much. Next is connect the nasal cannula to the oxygen setup with humidification and then adjust the flow rate as prescribed. Check the oxygen if flowing out of the prongs. Next is place the prongs in the patient's nostril. Place the tubing over and beneath the ear. With the adjuster under the chin. Alternately, you can place the tubing around the patient's head with the adjuster at the back or base of the head. And then don't forget to place a gauze pad beneath at the ear beneath the tubing as necessary. So, placing a gauze pad will prevent irritation to the patient's skin, especially if the tubing will rest on the patient's skin for a long period of time. Next is adjust the fit of the nasal cannula. The tubing should be snug and not too tight against the patient's skin. Next is encourage the patient to breathe in the nose with the mouth closed. Mouth breathing can cause poor oxygen concentration in the bloodstream, which can lead to high blood pressure or other medical issues. Mrs. Santos, please do your best to breathe in the nose with your mouth closed, okay? Thank you so much. Next is reassess the patient's respiratory status, including respiratory rate, effort, and lung sound. Note for any kind of respiratory distress like tachypnea, nasal flaring, and use of accessory muscle. Next is remove PPE if used and perform hand washing. Again, hand washing is very important because it prevents transmission of bacteria and microorganisms from one person to another. Next is put on gloves and then remove and clean the nasal cannula and then reassess the nurse at least every 8 hours or according to the agency recommendation. Check for any signs of blood or irritation. And then lastly, don't forget to document the procedure, findings, result, and don't forget to sign the medication administration record. And that concludes my return demonstration on how to administer oxygen by nasal cannula.